no symptoms of a growing polyp, and it was very subtle, which means that it could easily have been missed before it was removed. And this was potentially life-saving for him. So if he didn't, colonoscopies are nice because you can safely take out a polyp and something that's precancerous. He had no symptoms, and as many of you know, or my patients or people who've had colonoscopies, you don't have symptoms from this type of a problem, right? Hi everyone, Dr. Partha Nandi. Thanks for joining us. I'm on a different day today, on Thursday. Appreciate you joining us. Talking about something that I talk about all the time, which is colonoscopies and polyps. So welcome for those of you who have not talked with me. Before I talk about health issues, I talk about ways to be able to improve your life. Today I'm talking about Ryan Reynolds, and the actor. He's one of my favorite actors. He's always so funny, and even his posts on social media are funny. But I'm talking about colonoscopy, and he had a life-threatening polyp on a colonoscopy. So talking about, hey, you know what? Should you have one as well? So talking about this condition that he had, and colon cancer is the number 3 cancer killer in the country. So really important stuff, And again, we have a celebrity, which is one of my favorite actors, talking about that he had a colonoscopy, and do you need to have one as well? So really what began as a kind of a friendly bet between Hollywood actors, so Ryan Reynolds and Rob McElhenney, talked about having a colonoscopy, and then that turned into what? A life-saving, kind of a teachable moment. So what happened last year, they own a soccer club, and they had made a bet, and that McElhenney could learn. I'm sure I'm mispronouncing his name, but McElhenney could learn how to speak Welsh, and he stars in this. It's Always Sunny in Philadelphia. He won the wager, and Ryan Reynolds agreed to film his colonoscopy in public. It's nice when people or celebrities do that, because it adds, it increases awareness of the colonoscopy. So he lost his colonoscopy, and the doctor detected a polyp, a polyp that was precancerous and could have, right, potentially been life-threatening. So he had a colonoscopy that he performed, and told Ryan Reynolds that if he had not performed that, he could have actually gone on to become something worse. So Ryan Reynolds, importantly, had no symptoms of a growing polyp, and it was very subtle, which means that it could easily have been missed before it was removed. And this was potentially life-saving for him. So if he didn't, colonoscopies are nice because you can safely take out a polyp and something that's precancerous. He had no symptoms, and as many of you know, or my patients or people who've had colonoscopies, you don't have symptoms from this type of a problem, right? So, and his friend McElhenney also decided to have a colonoscopy, and his doctor removed 3 polyps. So exactly what is a colonoscopy? If you've never had a colonoscopy, you may have never heard about them. Preparation is the hardest part of this procedure. It involves cleaning out your guts and your bowels with the laxative the day before. That is the hardest part of the test. And the colonoscopy looks for changes such as irritated colon or polyps, which are tiny growths of tiny little almost pimples in the colon. And doctors like us, we can take it out. So the doctors typically use a long, flexible, lighted tube, and you're pretty much asleep when you're having this done. If any suspicious areas are found, your doctor can then pass surgical tools, or you can pass something through the scope to actually take out the polyp, and it's painless because you're asleep, and we can take biopsies as well. Now, when can you recommend a colonoscopy? When you have signs and symptoms, right? You can have abdominal pain, bleeding of the intestine, change the way your bowels move. Or for people like Ryan Reynolds who had no symptoms, it's a screening test to look for colon cancer or polyps. The gold standard, and it saves lives. Colonoscopies absolutely save lives, right? So colonoscopies also can be used as a follow-up test if something is found unusual during a screening test. So for example, you had a colonoscopy, you found a polyp. This could be a follow-up to say, hey, is it all gone? So big polyps is typically what happens. Your doctor may also, recommend colonoscopy for treatment, right? You can put a stent, which is a plastic tube that keeps things open. I have a lady I had today who had a stricture or narrowing of the colon. Nothing would get through, so it was able to put a plastic tube or a stent to be able to help. So sometimes a colonoscopy can be for that. Most common reason why people have a colonoscopy and is that the fact that they've heard about them, but the most common reason for not having a colonoscopy is that they said, "Hey, my doctor never recommended it to him." But that's why I want you to know that this is a test. If you're in the U.S., 45 years or above, you should have it done. If you have a family member, first degree relative, which is mother, father, brother, sister, had colon cancer, you should have it sooner. Typically 10 years before whoever in your family had it. So if somebody in your family had it at age 45, you should have it 35, or otherwise at age 40. So very important to know that. So a second most important reason why people don't have the colonoscopy is the bowel prep, because it's not always easy. You have to drink all these liquids and it goes through. It's one night, right? But it can save your life, like it saved, to me, potentially saved Ryan Reynolds' life. So what can you expect with a colonoscopy? Now, before a colonoscopy, again, you need to clean out your colon, any residue, because you can't see through that residue, right? If it's poop there, you can't see through it. So very important to look and make sure that you get that clean. Now, to empty your colon, people like myself will ask you to have a special diet, typically clear liquids the day before. And then, which can be plain water. It can be water, tea, and coffee without milk, and then without any cream or broth, and without cream, and you can have broth or even carbonated beverages. Avoid red liquids. Why? Because it look like blood during a colonoscopy. You take a laxative. One of the common ones is Miralax. You take a bottle and mix it with the liquid, and you drink it. And you have to drink the liquid typically the night before the colonoscopy. And then remember, remind your doctor of any medications you take, especially if you have diabetes, high blood pressure, or heart issues, right? If you have diabetes, typically you'd like to do it in the morning if you can, right? Remember, your doctor may ask you to adjust your medications. Really important to give your doctor good history to make it safe. What about during the procedure? Most doctors will give you a sedative or anesthetic so you're sleeping during the procedure. The sedative combined with pain medication that's given directly through your bloodstream through an IV can decrease the discomfort. So it's really taking away any of the discomfort that you normally feel. And then you lie on your left side typically with your knees drawn towards your chest. And then while you're asleep, the doctor puts the scope, the colonoscope, in the rectum. The scope is typically long enough, right, to reach throughout your colon, which is about 4.5 feet, and it contains a lighted tube, and you can pump air in, sometimes, carbon dioxide in some folks, and water to clean the colon if need be. Now, you use the air to inflate the colon, because if it's collapsed, you can't really see anything in it. So it opens it up, you get a good view of the colon, and then when air is introduced, you may feel a little cramping. That's why you got the sedation. And then the colonoscope has a little video camera, can see it. It's amazing the kind of detail you get. It's really important. And the colonoscopy typically takes 30 minutes, sometimes longer, but important. If you're watching and you're listening, hey, give us a shout. Tell us where you're joining us from. And this is important information. It could really save someone's life. So please share it with your community. And Lily Hunter, thank you. She just had 2 polyps removed. Tell us how your colonoscopy experience was, even if it's negative. Maybe we can help in some way. So when do you schedule a colonoscopy? As I said, doctors recommend that patients with an average risk of colon cancer consider colon cancer screening at age 45. If a family member has had a colon cancer, then do it sooner. Part of the reason it's important to get regular colon screenings is because you could have a polyp and feel completely normal, not even know anything about it, right? And this is the thing people say: if it ain't broke, don't fix it, doc. Well, you may not know it's broken, and that's important. That you've got to be able to try to get this when you can, so it's early, right? Colon cancer, third leading cause of cancer deaths in the U.S. Very important. Colon cancer typically affects older adults, although it can happen at any age. I've seen a lot more patients with colon cancer that are younger now. That's why the age of doing colonoscopies have gone down to 45. And it's a disease in which the cells of the colon or rectum can grow out of control. Sometimes abnormal growths called polyps can form in the colon or the rectum. usually begin as small, like benign cells or precancerous cells. Over time, they can go on to become colon cancer. So that's important. Colon cancer to me is highly preventable, highly preventable. And if you get early screening tests can find polyps that can be so they can be removed before they become cancer. It's very important. You want to get them in polyps; they don't turn into something bad. What about signs and symptoms? Very important. We said you may not have any signs and symptoms, but you could also have these signs, right? Persistent change in your bowel habits, including diarrhea or constipation. Blood in your stool is very important. Abdominal discomfort, which is persistent, such as cramps or gas or pain. A feeling that your bowels don't empty completely. Weakness or fatigue. Or unexplained weight loss. All those are important. Now, what about causes of colorectal cancer? Doctors, we're not sure about what causes all colon cancer. It's general, it's a matter of genetics, right? As well as your environment, which is your diet and the colonic environment. Remember, colon cancer begins when healthy cells in the colon develop changes or mutations in your DNA. The cell's DNA contains a set of instructions, right? And then that tells us what a cell has to do. Healthy cells grow and divide in a kind of an orderly way. But when a cell's DNA is damaged or changed in some way, it can become cancerous. They continue to divide out of control. And when the cells accumulate, you got a tumor. That's how it works. With time, the cancer cells can grow to invade and destroy normal tissue. Right? The cancer cells can travel to other parts of the body. We call that metastatic disease. What are some risk factors? We're talking about, what about risk factors? What can they be? Older age, colon cancer can be diagnosed at any age. It's important to know that. But the majority of people with colon cancer are older than age 50. The rates of colon cancer in people younger than 50 have been increasing, right? And we see that very often. I think it's a combination of many factors, including all the diets that we have and the environment. But we can't really prove that quite yet. If you're African American, increased risk. If you have a personal history of colon cancer or colon polyps, an increased risk. Inflammatory intestinal conditions such as Crohn's disease or ulcerative colitis, inherited syndromes. There's syndromes such as familial adenomatous polyposis and Lynch syndrome, and also known as hereditary non-polyposis colorectal cancer. So there's genetic syndromes that can exist. Your family history of colon cancer increases your risk. Having a low fiber, a high fat diet, also known as the American diet, can increase your risk of colon cancer. Remember, sedentary lifestyle, you sit in your butt all day, watch TV, that's all you do, can increase your risk of colon cancer. Diabetes can increase it. Obesity, if your body is not at the correct, optimal weight, then it can increase the risk of colon cancer and increase from dying from colon cancer as well. Smoking absolutely can have an increased risk. Alcohol, heavy use of alcohol can increase your risk of colon cancer. Radiation therapy for cancer. If you have radiation directed at the abdomen to treat previous cancers, that increases the risk of colon cancer. Important to know that. There are other screenings available, but I think that colonoscopies are the gold standard. You can get stool tests, which test for blood. There's a FIT test, which is a fecal immunochemical test, and you can also, in this case, there's also Cologuard, right? Cologuard. But all these are not as good as colonoscopies, which is the gold standard, in my opinion. You can also have a CT colonoscopies. Again, not as good, but better than nothing. If you can't have a colonoscopy, very important to at least have something. Cancer treatments. If a colon cancer is treated, develops, many treatments are available, including surgery, radiation therapy, chemotherapy, right? Targeted therapy and immunotherapy. American Cancer Society estimates for the number of colon cancer cases in the United States for 2022 are high, right? 106,180 new cases, 44,850 cases of rectal cancer. The first one I said, 106,000, is for colon cancer. And get this, it's expected about 580 deaths during 2022, over 52,000 people. From 2013 to 2017, the incidence or the rates decreased by about 1% per year. But this downward trend is in older adults, and it really kind of hides the rising incidence amongst younger adults since at least the mid-1990s. That's why we've decreased the age, right? So reduce your risk. How do you reduce your risk for colon cancer? Getting screened by colonoscopies. Eat lots of fruits and veggies and whole grains. Get regular exercise. Take control of your weight. Please don't smoke and avoid excessive alcohol. If your doctor didn't mention colon cancer screening, please ask them, right? The CDC recommends that you talk with your doctors about getting a colonoscopy to be able to help you save your lives. To me, colonoscopies save lives, and all the evidence shows that. So again, Ryan Reynolds, right? He's put his colonoscopy and publicized it so that we can then tell our patients that's so important. Colon cancer, number 3 cancer killer in the country. To me, it's preventable. So I think if you haven't received your colonoscopy yet and you're the right age, please do so. Remember, make healthy living a part of every day. Namaste. Thanks so much. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.